This is Dr. Latasha McElwain. Today, I'm giving an overview of my course at GCU University, which is the Case Management and Crisis Intervention Skills for Addiction and Substance Use Disorder. This course is definitely a great course when it comes down to talking about what case managers do, what they do in crisis intervention, what counselors do dealing with substance abuse and addiction. So this right here is discussion question uh, topic, week 6. And the topic is talking about what is case manager's role during a crisis, and then give an example of a crisis situation and what the role of the case manager would be. So on this one, this is a discussion question, and basically telling everyone what a crisis is one of the big things to start with. And what I try to tell everyone is that crises, when a person's in crises, they can be in crises for just about anything. Everyone crises are different. Just like I tell everyone traumas are different. It might be a crisis to you, or it might not be a crisis to you. However, it's a crisis to them. It might be a trauma for you. However, it might not be a trauma for them, or, it might not be a trauma for you, but however, a trauma, for them or whatever. I mean, a trauma to you, but for them it is. So basically, when we're talking about a crisis is basically a time of intense difficulty, trouble, or danger. A lot of times when we're talking about a crisis, that person is dealing with a lot of stress. They're dealing with a lot of things happening, a lot of emotions, and probably a lot of families, or a lot of family members, a lot of coworkers, whatever, social situation, people out in the community, whatever the scenario is, they're dealing with a lot. And sometimes an individual can be just dealing with themselves and be in a mental health or a substance abuse crisis. Okay. So a lot of times what I do tell individuals is that when we think about it, the crises take them to a place that things get really, really dark. Things get really, really to a point of feeling like they have a point of no return, and they've kind of lost control of everything. So, as a case manager, you jumped in a scenario like this, and now it's asking you, what is your role? Okay. So, normally, a case manager role, when we're looking at a crisis, is definitely to be there for an individual. They provide them with intense treatment. They can also provide them with some intervention services or intervention ideas and things of that nature. They're there to make sure that if they're there to witness the crisis, then they're there and they kind of know what happened. Or if they're there after the crisis has happened, they want to know what has happened, what's going on. They want to know everything. I can, being a crisis counselor for years, and being in the emergency room working with individuals, being a community crisis counselor, called the mobile crisis counselors, been with doing all of these, I can definitely say that I get the whole conversation from what's going on. So the information I'm giving you, again, and I said this in a couple of my videos before, that this is personal, learned, professional experience that I'm sharing versus it being more of the textbook. So, and the same thing with everyone that's going to be answering this question. You can share personal, professional, lived experiences also, to even give us the scenario, the crisis situation, and what the role of the case manager would be in a situation, even if you've had a situation. So want to definitely push that out. But basically, we definitely sit pretty much in crisis centers, or as crisis case management managers, to be responsible for assisting the individual, definitely helping them to complete different type of situational services. A crisis can be someone losing their home. A crisis can be someone needing financial support for something. So, depending on what we're doing in a crisis situation, we could be helping them with an application. We can be helping them with an emergency situation that needs an emergency application to do something, or emergency financial assistance for something. So there's so many things that we can think of when we're talking about a crisis for someone. But we definitely try to make sure that we're being able to complete an assessment, taking a verbal assessment from them that we can put on paper later, or actually doing the paperwork with assessing the individual. And then we're also looking at linkage, being able to link them to different services or different avenues of getting that support that they're needing, and then also being able to refer for different things that they also feel like they need, that deals with the appropriate needs of this crisis, and then also just being able to advocate for them, being able to transport if we need to set up transportation for them, whatever the case may be. We need to develop treatment plans around what has happened in this crisis, and then also be able to document and then be able to monitor. So those are all of the things that we are doing as a case manager in a scenario like this. So a lot of times I do tell people that we are there for the emotional support, helping people to, kind of get to a better coping level, getting to a point where we're de-escalating them. We are also looking at doing major, considerations in our head as far as, the planning, the implementation, the follow up with the things that need to be done. We are definitely looking at those areas to make sure that we're focusing when there is a crisis or a crisis has occurred, and we are following up on that crisis. So again, it almost looked like, I tell people, if you were just a regular crisis worker, you would probably doing your intake work, you would be doing some needs assessment to kind of see what's going on. You will be trying to get out there a service plan to see, okay, what are we doing next? And then come up with that plan. And then you also want to, again, monitor and evaluate. So all of those are parts of when we are processing through a crisis with an individual and something that's happened. So a lot of our skills, when we're working in an organization, we definitely want to make sure that we are able to coordinate. I've mentioned coordination in a few of the other videos as well. You definitely want to be able to coordinate. You definitely want to be able to create smart goals. You want to be able to create action plans and follow through on the commitments that are being made to be able to assist the individual that experienced the crisis. So going back to the assessment part, just a quickie right now, we are always typically assessing our individuals that we're working with, and we're always doing that because that's a big part of being a case manager, period. But when a crisis occurs, then a lot of times I tell people one thing I like about crisis work is if I don't hold a caseload and I am a crisis worker, that means that I am kind of that touch and go. So when I say touch and go, that means all of these elements that I just mentioned, the roles of a case manager, all of these are included where I am going to hop in there. I am going to, kind of see what's going on. I'm going to do that intake. I'm going to check for that needs and whatever needs they have. I'm going to check for service planning to see what we can figure out as far as the service that need to be put in place. I'm going to monitor and I am going to evaluate, and then they're going to move on. Or that monitor and evaluation might even move on to someone else when you're just a touch and go. That's what I call a crisis worker. We're touch and we're go. That's why I tell people in the emergency room, every time they come in to the emergency room, I say, please remember, we are not the community providers that they see every day. You do have a community provider that you're working with. They got all your information. However, we're just kind of touch and go. We're going to touch you. We're going to see what you're going to do an intake on you. We're going to do your assessment. We're going to see what your needs are, where we need to place you. And we're looking in the hospital emergency room. We're looking for what level of care you need. Do you need to go back home and follow up with your community provider the next day? Do you need to be observed in our emergency room so we can make sure you're okay? And then maybe our psychiatric team will jump in and do some med changes, or and just kind of monitor you and make sure you're okay. They observe you. Or the individual is going for inpatient treatment, or again, we're going to refer them back out for outpatient treatment. So it just, that's what we do, because we're crisis intervention workers. That's what we kind of are labeled as, and that's what we do for the most part. So this is a big one when it comes down to just knowing what the role of the case manager would be and what we're doing. Of course, like I said, we're there to talk, we're there to de-escalate if we're in the midst of the actual event. But yeah, we are there to be a support to the individuals. And depending on, sometimes how many individuals you got in crisis per se, or you got one individual in crisis, or, you could have several, like at the emergency room, we have several waiting, or as a community mobile crisis counselor, you have several people waiting in crisis for you. So if you got 7 or 8 calls that night, you've got to maneuver the counties, the city, or wherever you are to get to those calls. And yeah, it's just a good bit of being very coordinated, being very patient, being very organized, being very just put together, But I really like the question because the question does give you a good example of different things. Please give me an example of a crisis situation. Again, my crisis situation is normally in the hospital setting. I have had crisis situation where I've gone out to homes, and yes, we've started the process of the assessment and everything. I've even been on calls where we've gone out to the home. There was a crisis because one of the individuals just, as graphic as this may sound, but just didn't discover, just disclosed to his family that he actually had a um, a relationship with a younger individual, which ended up being a child, and this is an adult. And so it ended up being a situation of molestation, and it had just come to light. And I was called because the person was saying they were going to kill themselves. Well, I understand they were going to kill themselves, but also the police were called because that person was getting ready to go to jail. So when I got there, sheriff showed up on the scene too, and they ready to take them to jail. So at that point, I had to do some quick thinking with some stuff to make sure that they got their mental health needs addressed, even in jail. So I had to end up going down to the magistrate's office and doing an IVC on the person because the way that county was set up, they wanted it to be that way. And so when we did it that way, that meant that that person could get more services when they go in the jail versus going in the jail. And so when they got in the jail, they were able to be listed as suicidal and on suicide watch and everything else because that's what they were threatening at home, before I got out there. So that's an example of me just being that particular day. I remember a night. I remember I had to go over and above on this case, but I did it and I made the best of it, and I got the person over to the jail where they needed to be, and then the jail staff took over from there. And thank God I was out of it. But I say that to say I did a lot. I went out to the home. I had to make contact with the sheriff's department police when I found that there was a warrant and someone was coming to pick them up. Had to figure out what they wanted me to do from there. I went ahead and did my assessment, completed everything, and then went to the magistrate's office, took out the paperwork and all of that. Being at the home, had to talk to the patient and talk to the family because the family was devastated because it was a younger person that it's a family member. So it was devastating for them. And so that was another thing, if we could have had a social work out on the scene, that would have been amazing, but it was a small county. So I had to be that person kind of doing the round robin, making sure mom was good because mom was making sure dad was good. And dad was just because dad was the one who actually made the call for the mobile crisis unit. And then making sure that my patient was good, and the sheriff was on the same, all of us was on the same page. It was definitely a calm, civilized situation where he went and it was no problem getting them to the jail. But I just wanted to make sure that the services would be rendered once the patient got in jail and was booked out and everything else, and would be safe, that nothing could be that he wouldn't do anything to himself. So yeah, so it was definitely a lot. So that's my scenario, my situation. Again, like I said, just people come into the emergency room in general and working, and we just trying to make sure that we can try to take care of them. So that is all of what I have for discussion. Question number 6. This one is actually one of the weeks that we are currently in for this particular course, but I want to just give that little bit of information. And again, like I said, students, you can use any information that you have, situations you've heard of, situations that you've dealt with. for the most part, but this would be a good one just to figure out what is my role as the professional case manager. What am I doing? And I think everyone will do just fine with this, with some of the information that I gave and all the information that you've learned over the course of this course. And I know folks that are coming into this course will hear this as well. But I try to do for many of the courses these little snippets for discussion just to try to help individuals through and make sure that they can get a good understanding of what they're doing and how they're looking at their assignments and their discussion questions. Thanks so much for listening, and I hope you have an enjoyable day, evening, night, or afternoon. Bye bye. See you next time.